Hello, welcome everyone. I know folks are getting into the room, so we'll give it just a minute here to let everyone enter the webinar room this afternoon, and then we'll get started. Thank you so much for being with us today. Okay, welcome everyone. We've got, as always, we've got a lot to cover today, and we're very excited for today's session. So we'll go ahead and get started. Thank you so much for everyone for being here. My name is Sandra Ranum, and we're, as always, very excited about our fourth webinar today in the Foundational Technical Assistance Series hosted by the National Early Care and Education Workforce Center. Today's webinar is being recorded, and we will share it out via email as well as on our website. If you have questions today, please don't hesitate to put them in the Q&A. You'll see that option down at the bottom of your screen. We will do our best to answer the questions during today's session, and if we're not able to answer all of them, we will follow up. And so want to start with this message that we share at the beginning of all of our sessions. The work of the center is funded by the Administration for Children and Families. However, the views and perspectives shared during this webinar do not necessarily represent the views of or an endorsement by the ACF. So we'll get started with introducing today's facilitators. I'm sure you're excited to see both Dr. Sherry Killen-Stewart and Dr. Aisha Ray again today. They are both from the BUILD initiative and are the facilitators for the entire foundational series. So you'll see them today as well as in our last two webinars over the next couple of months. And today we're excited to be joined by Dr. Christy Snuggs on the next slide, if possible, from the Child Care Services Association. And so she'll be sharing the CCSA's work to support the ECE workforce broadly, as well as their work more specifically in North Carolina through the years. So we're excited to have her joining us. And we will start with our first poll. We'd like to hear from you all about your participation in the first three webinars. And if you weren't able to attend those, if you've been able to watch the video from those sessions. So if you can just take a moment and let us know about your participation there, that's helpful for us to just know about that ahead of time. So we'll give you a minute to respond, and then we'll get into our content for the day. And so let's see, Daisy, do we have some responses that we can see? Okay, it looks like a good percentage of folks have been able to see the information and share it with at least one or more of your colleagues, and others plan to do so. So that is great. We're so excited to see you all engaged with this information. And with that, I will turn it over to our facilitators to take it away. Thank you.
Hi, good afternoon, everyone, or good, I think it's afternoon everywhere, but it could be morning somewhere. Welcome to the fourth webinar for this series. I am Aisha Ray, very happy to be here with you and with my colleagues. We're going to start out by talking about where we've been and where we're going with the remainder of the series, particularly focusing on the 5 policies in the early childhood workforce needs and that this project is focusing on. Next slide. We want to, in this session, in this webinar, think about application and action into policy areas, the area of work environments and the area of qualifications and educational supports. We're at the midpoint, and so we're going to review where we've been and where we're going. We're going to support early childhood care and education leaders to use their roles, responsibilities, and authority to develop policies, practices, and programs to increase opportunity and remove barriers in these two policy areas I mentioned. We're going to apply processes and strategies and tools we've discussed in the previous webinars and consider multiple levels of change to build effective networks, use data, listen to the workforce, and strengthen cross-systems work in these two policy areas. And as Sandra just indicated, we're going to have our partner, Dr. Snuggs, talk about the important work that has been going on in North Carolina. And some of that, a major part of that work has been to support the early childhood workforce, families and children, including in these two policy areas. Excuse the typo there. Next slide. We want to remind ourselves always that we want to begin. My colleague Sherry Killens and I love this quote. We think it's sends a very important message. If you have come to save me, you are wasting your time. But you have come because somehow your liberation is wrapped up in mine, then let us work together. In the spirit of this whole project, I think, is really to build community across many different components of the early childhood community and workforce, and to try together and with others outside of the early childhood workforce to bring about significant changes for our workforce and therefore for children and families. Next slide. We developed this particular image because we were trying to convey both the complexity of the system and also its important components and their relationships to one another. The universal goal of the project is to build this high quality and equitable early care and education workforce, and so that all children and families succeed, and the workforce itself succeeds and thrives. In order to do that, we've got to have strong roots, and the roots are in this sort of pink component below the tree, obviously. It includes all of these key components: training institutions, professional organizations, accreditation, advocates, workers, and including unions and others who advocate for workers, legislators, federal systems of state and tribal and governments, higher education institutions, regulations, and so forth. All of those components have to be healthy and working well together, independently and together, in order to create the foundation, the roots of the tree we're trying to build. That tree, which is a system of early childhood that is, as we said, of high quality and equitable for all children, for all families, and for the entire workforce as well. In order to do that, that tree is growing in an environment where we need data. We need to use and activate and take action in our roles and the responsibilities we have to try to bring about change. We need to work with people and groups and other structures in order to build networks and systems that can deliver what is necessary in terms of change. And above on the tree, what we see are a set of items that will grow effectively if we're able to do that: compensation, program quality, tailored responses to the workforce, and so forth. So we want you to feel free to use this image in your own work when you're talking to others about what we're trying to do, and just borrow whatever you want from these PowerPoints. But we think this image helps to make both a colorful demonstration, but also one that captures all of the key parts. Next slide. So we want to go back very quickly and look at what we did in webinar 1, 2, and 3. In webinar 1, and each of these webinars, we presented what we call process elements. That is, things that leaders can do to, in their roles, to bring about to build the blocks that need to be built for our system. We need to take action. We need to use data. We need to understand root causes. We need to focus on the authority we have within our roles. And we need to target levels of change and work with people across a variety of structures. In each of these webinars, and for webinar 1, we had 2 innovative models: All Our Kin and the Cook County, Minnesota Health and Human Services Child Care Licensing Office. And both of those entities provided information that helped us look at those process elements in ways that identified, I think, some of the strengths of the process elements and some of the challenges as well. Next slide. In webinar 2, the process elements were data. We focused particularly on qualitative and quantitative data and as resources. We looked at how data can help us tell stories, but it also can't tell all stories, and discussed what we can use, how we can use data and how we can't. We looked at the status of the workforce, its leaders, specific states of or areas of work, such as childcare, and the innovative models we use were the National Workforce Registry Alliance and the Nevada Registry Telehealth Services to illustrate again some of the process elements that needed to begin to bring about the change for our workforce. In webinar 3, the next slide, the process elements we focused on were really around building networks and relationships across systems. Leaders can build and use effective networks. In fact, they have to do this. This work cannot be done alone. And we'll talk a little bit more about who we're looking for. We're looking for leaders who work together. We're not expecting people to be superheroes. The innovative models were apprenticeship programs, such as early care and education pathways to success. And we looked at the benefits of cohort models to also think more about the process elements that we had been presenting in those first 3 webinars. Next slide. In webinars 4, 5, and 6, we are going to focus on the 4 remaining policy areas. We looked at data as a policy area and how important it is in order to make the kinds of change we want. In webinars 4, that is today, we're going to talk about qualifications and educational supports and work environments. We're going to talk in webinar 5 about compensation and financial relief, and in webinar 6 about financial resources. So we're going to cover all 5 of these in the remaining 4 of these policy areas in the remaining webinars. Next slide. So we need cross-systems leaders who can really bring about the changes we want in work environments and in qualifications and educational supports. So we're looking for also those leaders who can use multiple levels of change. Next slide. So let's take a quick poll. What is the current status of your work on early childhood care and education, work environments, and qualifications and educational supports? Currently, where is your state, tribe, county, or community in terms of its work to intentionally and consistently address these 2 areas of policy? Are you just beginning to intentionally and consistently address them? Have you been working on these intentionally and consistently for at least 12 months? Or have you been doing so over 12 months? Or none of the above? So we'll give you a chance to answer that poll. So do we have results? Okay. So 22% just beginning to intentionally address these 2 policy areas. 22 have been working on them intentionally and consistently for at least 12 months. And 50% have been consistently intentionally working on these for over 12 months. So really 72% of you have been doing this for at least 12 months or more. That's very impressive. I encourage you to continue to do that work. Next slide. So now we were going to ask you to share your understanding a little bit more deeply about that work. For those of you who answered poll 2 with 1, 2, or 3 as your choice of response, considering the work environments or qualifications and educational support, who or what entities are at the tables with which you're making these decisions? When you're working on work environment policy or qualifications in educational sport, who or what entities are at the table? So you could put in a phrase or two describing those people or what they represent. For instance, county government or child care services or what have you. And we'll wait for your responses to this. So do we have the responses? I don't see them yet. Ah. Okay, so lots of different people are at your tables. State departments of ed, state R&R, early childhood centers, licensing, higher ed and state education agencies, providers, advocates, a rich array of the early childhood field, tribal leadership community members, licensed providers. Excellent. So let's go to the next slide. So the next slide asks you to, for those of you who answered 1, 2, or 3 in poll 2, that you were doing work or attempting soon to do work on these 2 policy areas. This question asks you who's not at your table and should be. So very often in early childhood policy, we're including people who we know and we've worked with before. But in trying to build equitable systems, we understand that we have to really think beyond the usual suspects to those people who may be excluded because we haven't thought of them. So who are those people or those entities that need to be at your table, but around these 2 policy areas, but are currently not there? So district, people from the district, a school that might be the school district, classroom educators, tribal childcare, parents, business leaders, state legislators, family friend and neighbor care. Oh, this is an excellent list, but it represents some of the challenges I think many are having in the field about who is not present enough. So it gives us a lot of food for thought as we look at this list about how to include those individuals who are not there, but we recognize should be there, and to probably stimulate us to think more. It is difficult to get father and especially young fathers there is the response. So thank you so much for that. And we can dig more deeply into that and reflect on that in the next webinar, because we are going to talk about some of these results in the future webinar as well. We wanted you to think about another question, and that is when you look at, hold on, I'm sorry. When we look at trying to build the relationships, networks, and systems to address the early childhood workforce conditions and qualifications, what are the things that we need leaders to be able to do? And next slide. My colleague Sherry Killens is going to talk about that question and also lead us through the next section. Sherry?
Thank you so much. We want to show you a video clip which we think is important because each person as leaders needs to observe what is important to others. You gave us a great list of partners. You talked about those you're connected to and not connected to. We need to understand what's important to them. We must be able to see solutions, and we must be able to take action together. And Dr. Ray and I've used this a couple of times. It gives you 4 tools to think about as you're trying to make change in any area, which we will then apply to the 2 topics today. So Daisy.
Thank you very much for this opportunity to the organizers. I just want to begin my talk with a little story. When first I came to the States, I was in a barbecue here on campus. That was like 2.5 years ago. And one of my American friends approached me and asked me, so which kind of superheroes do you guys have in El Salvador? I was like, we don't really have superheroes down there. And then I started digging up a little bit more in that answer. And then I realized that in my country, since the very beginning, in the family and in schools, we are taught that if we want to see change, if we want to foster change, we have to get together with other people, build relationship, and act as a family, act as a community. That's why we don't really feel the need of superheroes. Having said this, my talk is about that, social change, community, and superheroes. And when I was crafting this talk, I started doing a little brainstorming of the ideas that came to my mind when I heard social change. And the first thing that came to my mind were names of people that have done great contributions to societies around the world, like Martin Luther King, or Mahatma Gandhi, or Rosa Parks, or Cesar Chavez. And the problem with these iconic figures in history is that they are portrayed as icons, almost as godness. And we kind of relate them to superheroes. So we can see that superheroes are not only in comics. Superheroes are also in the way how we learn history. And that's very dangerous because we don't really feel connected to these like big social leaders. And we feel that we don't have their power to foster change in our society. For example, I'm not feeling really capable right now of gathering 250,000 people and bring them to Washington in order to foster some very landmark act. I don't feel like I have Martin Luther King's power. I feel disconnected, but it's because I have learned that Martin Luther King was a very special person, like a hero, and I feel like I'm more normal. However, I'd rather conceive these social heroes as community organizers, and I'd rather dig up a little bit more into history, and I realized by myself that these people were not alone. They really built power among the community. They were not doing these things by themselves. They reach out to churches, they reach out to other communities, and that's why they were capable of fostering these big landmark transformations in their own societies. And there is a huge difference among heroes, superheroes, and community power. And as you may recall, superheroes usually act alone by themselves. They climb buildings, they can fly, they don't need anyone. While community empowerment is all about reaching out to people, making connections, doing relationships. Also, superheroes are most of the time hidden. They have a hidden identity, they use masks, they don't want to be noticed. While community organizers, they need to become public, they need to showcase their plans, whatever they're capable to do so. They need to be there in the public scene. Additionally, superheroes build dependence. Citizens are dependent on superheroes. What will Metropolis do without Superman? Nothing. They are fully dependent on Superman. But community organizers, they try to build power in the community. They try to empower regular people. And they help them realize that they are capable of fostering change if they act together as a community. And finally, the most important difference is that superheroes do not transform society. They only fight evil in the surface level. That's why we have so many movies of Batman, like Batman 1, 2, 3. I think next year is going to be Batman 15, because there are evils coming and coming and coming. Batman hasn't been able to really transform society in such a way that wouldn't allow more evil people to come to the city. Having said this, I need to clarify the concept of social change. For me, social change is intrinsically related to social justice. And social justice is the way how society delivers wealth, opportunity, and power among society members. So any sort of social change has to do with that, has to do with transforming the society in a more equal and fair environment. And I want to put an example on this. For example, food stamps. Food stamps are very good, but they are not really fostering social change, because food stamps are not really transforming the economic structure that is excluding people from the capability of going to the supermarket and buying the food by themselves or growing their food. Food stamps are just in a surface level. They are not changing that economic system that excludes people. I'm not saying that food stamps are bad, but are not social change. Can be a public welfare program or could be charity or goodwill, but they are not social change. Social change has to do with social justice. I want to give you 3 concrete takeaways beyond this theoretical concept of social change. And these 3 takeaways, I didn't read them in a book, I didn't learn them watching movies, but I experienced them by myself in social movements. The first one is this picture. That's a gigantic human chain of 1,000 people covering almost a mile. And what they are doing is that they are bringing together 2 monuments. One monument is representing monument to the justice, and the other one is representing dignity. This took place in El Salvador, in a country that poverty rate is over 35%. So when I was back there, I was working for a nonprofit, and we decided to take a step farther. We decided to affect the decision-making structure that was excluding people to poverty. So we invited the communities that we were working with all over around the country. There were around 25 communities. And we asked them to come to the capital and to voice their needs, which means that although the general topic was there is no dignity without justice, communities were allowed to claim and advocate for their own issues. For example, some communities were advocating for land rights, or clean water rights, or violence, or lack of safety in their communities. So the takeaway of this successful public demonstration in this social movement is that communities and the participants really owned the activity. So ownership will be a very key element in social movement. The next picture is back in El Salvador. That's my town. I was born there. And El Salvador also is very well known because it's high crime rates. So nobody there goes out at night by themselves. And we and some other friends decided to challenge that perception. And we decided to go out for a run at night. It was a short run, like 4 miles. When we went back, like an hour later, we felt something good. We felt like we had fun. But besides that, we felt excitement because we were challenging very well-known and spread perception, the perception of unsafety. And because it was good and we enjoyed it, we decided to replicate the same run the next week, but with more friends. We decided to invite more friends. So the next week, we were not just 4, we were 13. And the next week, we were around 35, and so on and so on. After 2 months, we were 200 people, 200 citizens running every single week at night in El Salvador, one of the most dangerous countries in the world. Now, I came to the States, and some other friends took over the leadership of the initiative, and 3 years later, they are not 200, they are 500 runners. And they do not only run once per week, they do it twice per week. So we really transformed the city by just doing some sport at night. And now the city is not alone at night. You have hundreds of people there, and they are taking care of each other. You have thousands of eyes there that are witness of anything that may happen there. It's a safer city now. The takeaway of this experience is that I didn't show you how the movement looks like now. Yeah, that's like around 500 people right there. And the takeaway of this movement is you have to do something cool, something that the people really like, but at the same time, something challenging. We were challenging the perception that nobody goes out at night in El Salvador. And for young people, that's very attractive. And the last experience that I want to talk about is in Campaign for Change. That's my job. I'm the full-time organizer for this grassroots initiative in the next city to Bethlehem, which is Allentown. And as you may know, the American public education system doesn't work in the same way for all. Especially doesn't work well for African Americans and Latinos. And in Allentown, there is a huge concentration of Latinos and African Americans. So we decided to do an assessment of the school board and to try to make them realize that they are accountable to the people who pay taxes and who vote them into power. So we used a very well-known tool that teachers use to grade the students, the report card. Everybody who goes through the American public education system receives periodically report cards in order to inform their parents how their children are doing in schools. So we asked the community to design a report card for the school board. So the community designed this huge report card in English and in Spanish, and we failed them in some categories. And we publicly delivered this report card to the administration building. And it was great. We had a lot of media coverage. We had the Morning Call, Channel 69, the Express Times covering that activity. And it was a great and easy approach of how to empower the community, how to make them realize that they have the power of hold these public officials more accountable, using the same tools that they are already used to. And that's the takeaway of this experience. Use the tools that are already available in your own community. In this case, the tool was a report card. Everybody knows, and everybody knew in that time, what was the report card for. And I need to put these 3 takeaways in a broader perspective. Right now, in the world, we are still facing hunger, we are still facing wars, we're still facing crime. However, we have the technology, knowledge, and resources to solve it. But nobody is doing nothing meaningful regarding solving these issues. And it's because frontline communities and people who are really experiencing these issues in the world, they don't have the political power to use the resources and technology to solve those issues. But now, I'm giving you these 3 specific takeaways, these 3 specific steps for you to use them and start your own social movement. And my last message to you will be, you are not superheroes. You are real. You are real people capable of transforming your own society. Thank you.
Thank you all so much for watching that. I just want to review a couple of messages. One is that you have to really see the community, and the community for us is the workforce. And Dr. Suggs will give us some more examples of that later. You got to be able to see partners, that this isn't about a superhero. You're it if you're playing tag in any sort of way. He talked about a community-owned activity. And so we want to encourage you, and Dr. Ray's going to talk more in a minute about the process and making sure, and we've said this in earlier webinars, that we're actually listening to the workforce and what's important. We also want to take on something that's a challenge and make sure that we're doing the things that are a challenge. And I'm going to give you a poll question in a minute to start you thinking about what tools you have. He ended saying, you know, we have the technology, the resource, and the knowledge. And a lot of us are on multiple groups, and the complexity of the graph earlier reminded us of that. So let's think about the tools. Daisy, you want to launch the next poll, which asks you two questions. When you think about the workforce and you think about the challenge, he called it a challenge, which are your top 3 challenges that you're trying to address? And then the second question, and you don't have to map them one for one, but what tools do you have to achieve your goals? Believing that we have tools in this space, which tools do you have to achieve your goals? So let's take a minute and share with each other. Hey, Daisy, how are we doing?
We are 60% now.
Okay, like 10 more seconds. Don't overthink it. We're just using this as a way to see where people are landing. Okay. Okay, looking at our results, the top 3 areas are around compensation and financial relief, real knotty issue, qualifications and educational support, work environments. Both work environments and financial resources are really in 3rd place when you think about it. So people may feel they're making more progress around workforce data. If you chose other, I think you can put it in the Q&A and we'll be able to see what that is. We'd love to understand what else you all are thinking about. And love that you see that you've got tools to achieve your goals: grants, policy, legislation, scholarships, program models, technical assistance, and a few others. And again, if you can use the Q&A to give us an idea, but this is one of the points of looking at this video, is that we have to use the tools we have, and that we're not heroes. And so we've got to work with others on some really hard issues, beginning with listening to the field and then moving through taking on the big challenges and then using the tools we have. One of the things that we've shared with you before is that we believe this change happens on multiple levels. People get to make personal decisions. You all in your roles can continue, as we've tried to share, understand the root causes. Dr. Ray mentioned earlier that the root causes of some of these issues go way back in policy and in practice. We want to encourage you to get to know people different than yourself at the interpersonal level. That means that you don't always have to have an answer right away, but you certainly have to listen to make sure you can get the 500 people out working, or you can get the 1,000 people working on the issue from their side of the elephant, but move this big audacious task. And then we've got to be thinking about institutional changes. You know, what are the policies, practices, and programs around the things that we are responsible for, whether that's professional development or giving grants or contracts? How can they be tools to do those top 3 things that you think are most important? And then we all hope for structural change. These are the policies and the rules, the idea that families wouldn't pay more than 30% for childcare one day, or that we might have a salary level that was appropriate for the early education and care workforce that was structural and that we didn't have to each do it individually. Some other examples are if you have quarterly meetings with educators, and I like those meetings to be with the same group of educators so we can build our shared understanding. I like those meetings to be in the hard places, the places that are harder for us to get to, and listen, because those are the places where if we plan and tailor for those communities, others will benefit. But there are also things at the institutional level, holding courses in housing projects. I've known a person to do that, and several people, of course, got their CDAs when it was convenient and available to them. Adding a day for professional development to subsidy contract so that the early education and care workforce can have the time off to do the additional training you may be asking for. Satellites in rural communities versus having people drive the 2 hours, have the courses go to them. Maybe they're longer, maybe they're all day Saturday, but tailoring it to meet their needs. Building vacation days. One of you recently done that, built vacation days in the subsidy contracts. We also need to think about retirement in subsidy contracts. Wage scales, many of you are working on that, and creating paid time off for early educators. And then structurally, we see things like a tax credit in some places for early educators, providing discounts in stores. Many stores give discounts to teachers, but if we don't give folks an ID that says they're a teacher, they're not able to benefit from those discounts. And then bonuses for infant and toddler teachers and assistant teachers through county tax funding. One of you has done that as well. So these changes matter, and doing it at multiple levels makes a difference. Also, the system is complicated. We know that we've got multiple funding sources, Head Start, child care, public preschool. All of these different institutions have different funding streams and different ways of working. How are you using your relationship, your sitting on work groups to create a shared agenda across position types, across settings, across the different support organizations? Even professional development for different groups is done in a different way. So this complex slide goes with the earlier one we showed about the workforce, but it shows you that the people who care and educate our youngest children are in multiple settings with different roles and different, sometimes, job titles. One of the things that's important when you're thinking about that complex slide I just showed you, or the one that Dr. Ray showed earlier of the tree, is that you got to identify the actors. This is not work you can do alone. That was the reason of saying, you're not a superhero. And we want you to identify those that connect to your workforce challenge, whichever one of the top 3 you picked, and think about it related to credentialing and the work environment. And not just the usual people that are in your social network. Sometimes there are people outside that you need to think about. And make sure that as you're putting actors together, that you're including those who are benefiting the least, racial and ethnic groups, which often don't have access. That means you have to tailor your meetings. It means it might be on Zoom. You might have to go out an hour to have the meeting versus people coming in, so that they're a participant in designing, regulating, and redistributing resources. And really, again, we make this point about engaging all actors, because each person has to be informed and meaningfully involved for us to get a solution that is going to support them. So thinking about workforce and qualifications and educator support, who's missing and how can they be engaged? So another poll, which partners, there's 2 questions. This is on which partners are you working with to advance policy changes in education and qualifications and supports? And the second question is, who are you working with on it on work environments? And again, this is not intended to be an exclusive list. There are other people, but let's see where we are on this list. Daisy, you want to launch the poll?
It's launched.
Okay, Daisy, let's see what we got. All right. All right. So we're recognizing about half across almost all the areas recognize the role of federal, state, and tribal entities and higher ed, state systems that control accreditation, licensing, advocates, professional development, less so on legislature. And that means we're thinking about the resources that we have, less so on unions. Which partners are you working with to advance policy changes in the area of work environments? Here we've got, again, the federal government, grantees and agency directors, a little less the Department of Labor, private providers, professional organizations, the workers themselves, families, and legislator. Thank you for participating in that. So as we move on, it is really important to look at your leadership and make sure that you are accelerating and advancing things in your current work, to really dissect your own work and what you could contribute to each of the areas you picked in your top 3. And how can you get agreements? If you're on work groups or coalitions, how are you using them? And I understand it needs to be situated in local context. So often if we're at the state or at the region, we need to pay attention to the local and make sure we build in ways to really effectively listen to others, because that's what's going to create sustainable change. Often a policy is created, but without that continuous feedback loop with the people you intend to benefit, it doesn't get implemented as intended. Thinking again about cross-sector teams, you really can't address any one of those issues by yourself. You all have proven that through the multiple polls today. It's important because different people hear it from different ears and different people have different expertise. There are lots of leaders sitting on and managing grants that they may not be using that tool to advance the change that you want. And often programs are seen as transactional, and each one of them is a tool to be able to get to the change that we want. So how responsible are you seeing yourself? That's this next poll. Within your role, responsibility, and authority, are you responsible for work environments? Can you see some responsibility around qualifications and educational supports? So let's get a sense of the group on these 2 topics we pulled out to talk about today. Okay, Daisy, how's it look?
We're at 43, 44, 45. Almost there.
Okay. Okay, let's see what we got.
There we go.
Okay.
6
All right. So less of you feeling very responsible around the work environments, minimally responsible, but I bet that means you're on committees and work groups where you could use influence. You may not have the authority, but you may have some influence. Some not feeling responsible at all. So I'd encourage you to think about what tables you can get to, how you might be able to influence work environments. And on the area of qualifications and educational supports, we've got some that are very responsible and minimally responsible. In fact, most are feeling some responsibility, and some very few in the not responsible at all. Again, I encourage you to think, because everything from carrying the voice of the workforce to actually going to the legislature and writing and supporting and implementing the policies that are passed, there's a large range of activities that you can have to support the kinds of changes that we want to see. So the next category is really, so what is success for you? Because success helps you also think about who the partners are. And so this first Mentimeter says, how do you measure success if you think in the next 2 years, you've done a core strategy around the work environment? And when we talk about work environment, we're thinking about things like planning time, like time away from work to be able to pursue education, things of that nature. Can you think and give us your ideas of what success might be? So you could put a word or a phrase in the Mentimeter, and then we'll look at those. Daisy, why don't you pop it up so we can catch up a little? Okay, so we're getting some answers about paid training days. Some aren't as clear how to contribute. Retention of teachers, wage parity, fully staffed programs would help with the work environment. Time off to do the advocating that we're talking about. Teachers and directors report being paid time to plan and time to spend with colleagues and coaches. Yes, I've heard that's a challenge in the field. These are the successes, and we'll bring these back as we continue to talk with you. So what are successes? We'll switch to the next Mentimeter and tell us what are the successes around qualifications and educational supports. What does success look like there? Because here we want you to take the idea of partnerships, that you can't do it alone, listening to the field, and then we want to work towards these successes by creating the right set of actors to move us forward. But let's think about qualifications and educational supports quickly, and then I'll turn it back over to Dr. Ray. Okay, great. Thank you so much. So in the next 2 years, we want to see things about the CDA. We want to see scholarships and paid time off. We want alternative pathways offered. We want child development permit being revised. We want to get real about the work. We need to talk more to us about what that means. We want to continue scholarships in the EC. We want classes in Spanish and a unified requirement rewards for getting higher ed. We want more education qualification, such as teachers with an associate's degree, clear, affordable pathway to higher education. So if these are the successes, you know how to name the successes. Dr. Ray is now going to talk about a process to help you get to some of these successes. Thank you.
Thanks, Sherry. So as we move towards trying to make the achievements that you have laid out in those last Mentimeters in the next 2 years, we really need to apply some of the processes and strategies we've talked about. And I want to just focus on those briefly before we hear from Dr. Snuggs, who I think is going to also help us think deeply about this. We've talked in this in the webinar series about the process, understanding the root causes, taking action together, working with others across multiple sites and settings and programs, using data to help tell stories and help us understand where we're going and whether or not we are succeeding in where we're going, and then leveraging our roles, responsibilities, and influence in our leadership positions. Next slide. We also, in using those process strategies and tools, want to think about specific aspects of the role that you may have, your authority, what decisions you can make, what kind of directives you are able to deliver, enforcement of policy, how that gets done. Is it fair? Do you need to try to use your role and influence to change the way the policies are being enforced, or to ramp them up, or to at least think about particular communities where those policy enforcement may be more problematic than it is in other communities, and to think about grants, applications, design, and review. What do those look like, and how can you shape them to help achieve the goals you want to achieve in the next 2 years? Where can you use your influence, around status, role, and expertise? in interdepartmental committees, in work groups, and in partnerships and other kinds of meetings and gatherings, how can you bring the kind of, you may not have full authority, but you have the capacity to influence in discussion, in your writing, in your work with others, the direction of policy practices and the work that you're doing is moving forward or not. Another area is your responsibility around activities, programs, technical assistance, and monitoring. Each of these areas and others where you're responsible, you may not have total authority, but you're responsible for delivering on some aspects or all of the aspects of particular areas of the work that you're doing. How can you use that to also bring about change? And then how do you use the tools for decision making? When budgets get drawn, are there ways to affect the way the budget is drawn that helps you achieve your goals more for the workforce more effectively? What about design rules and policies in that in the area of designing the rules and the policies? How can you use that particular decision-making process, again, to advance what you want? Also with initiatives, and work with key decision makers, and particularly the use of special funds. So these are just some of the ways you can use your role to make impact. We want you to think about others as we move forward. Next slide. And apply them in your work. One of the important things, of course, is to identify the problem or the challenge clearly with not just by yourself. This goes back to the message that I think we've given around, one, you're not a superhero, but also to get what needs to be done effectively for our workforce requires that we really are working with others across a variety of areas. We want to, in that process, we want together to be sure that we all agree what the problems are that we're trying to address. What is the problem and how is it related to the EC workforce? In terms of qualifications and educational supports, what are the key problems or the problem that you're trying to address? What about in terms of work environments? What is your time frame for doing that? This is also very important. You can have I have a grand plan, a grand thing that I would like to have happen in my work in early childhood for the early childhood workforce, and that's for everyone to receive pay parity across all of the field. I think that would make a huge change, but that's a big lift. What's a smaller area of that problem that I can try to achieve? So there's the identifying what the problem is and working on how to frame it in ways that will help me achieve those goals. We want to consider the connections to the workforce and the feedback loops that we've developed in order to move the problem toward the solutions we've identified. We want to consider what we're responsible for and have the tools for solving within the roles we have, responsibilities and influence. Dr. Stewart just asked you to take a poll about the tools you have. We think this issue of tools is very important. Tools and responsibilities go together and can go together in very productive ways. If we don't have the tools, we can have a great analysis of the problem, but we don't have the tools to actually address it. And what is the workforce problem's ecology, especially its root causes? Understanding that helps us understand, in some ways, the interconnectedness within systems that sometimes keeps that problem in place, or the conditions that develop that problem in place. So understanding root causes is very important, and the ecology of the problem. And in relation to our workforce work, how do we measure success in our current work? The measuring of success is both how we measure it right now in the next 2 years. We gave you a 2-year limit in these previous metameters we asked. But what about 10 years from now? How do you lay out the timeline for achieving the goals you want? And how are you measuring it along the way to see, are we actually making any difference in trying to achieve the goal we want? Next slide, please. In defining the population, we want to look at who benefits and who does not from current actions and solutions related to the workforce problem, specifically identifying how they are impacted differently. We know, for example, from data from Berkeley that and other researchers, that people who work in the infant toddler area, particularly African American women, are disproportionately earning less than people working in other sectors. Also, race influences, even when people in our workforce have equal degrees, they may earn different money that is reflected in some ways in their racial background. So how do we look at that kind of data and other kinds of data? Who's benefiting, who's not? How do we actually try to address those issues? How do we use quantitative numbers and qualitative stories to create as evidence for understanding inequality and how it exists, and what evidence is missing and needed, and which populations receive maximum benefits and which have fewer benefits associated with access to programs, services, and opportunities for the workforce that will help us to develop the policy changes we need. Next slide. We also want to examine the causes, as I mentioned earlier, what factors may be producing, perpetuating workforce problems, how do they arise, and so forth. And we'll move on to the next slide because I think we've talked about this issue. And then we want to use leadership strategies that are responsive to workers' voices on these issues of qualifications and educational supports, such as providing paid professional development days for all educators and programs, funding training and professional development, offering courses in more than one language. Dr. Stewart mentioned some of these changes as well. So we need to think about the strategies that will really help us get what we want to achieve. Next slide. We want to make sure that leadership strategies are responsive to work environments, continue full staffing in programs without full enrollment to reduce child-adult ratios, and increasing the diversity of the workforce and leadership, building up the feedback loops with families, providers, and educators to create responsive practice. Next slide. And in beginning to use these kinds of processes, which we've talked about throughout the webinar series, and we'll talk about again in webinars 5 and 6, and specifically want to make sure that we are able to really understand those elements that will help us be most effective. Not waiting for superheroes, recognizing our own ability to act, and focusing on comprehensive approaches to systemic change, the 5 policies as opposed to single wins, working for equity, consistently and intentionally listening to others in the workforce in particular, and using strategies to build networks and cross-systems approaches. So with those things in mind, I want to turn this over to Dr. Snuggs, who's going to use some of these ideas that we've have talked about throughout the webinar series and reflect on how they surface in her work, but also show us new and innovative ways that perhaps we haven't all thought about yet. So Dr. Snuggs, please. Go forward.
Thank you, Dr. A. Thank you, Dr. Stewart, for setting such a wonderful stage and really giving me the opportunity to share how our small organization has made an impact and then how that's led to impact at the state level as well. Next slide, please. So I'm going to talk specifically about moving the policy levers to improve ECE qualifications and educational supports, but work environments will also be addressed throughout this presentation. Next slide. So I want to tell you just a little bit about who we are. I am Christy Snuggs, and I am the president of Child Care Services Association. We have been in business for 50 years. So when you asked the poll question earlier about have we been working on this for a year or longer, I wanted to say 50 years because we have been doing early care and education advocacy and workforce innovation for 50 years. With a vision that all children will have equitable access to affordable, high-quality early care and education that we know laid the foundations for successful life outcomes. Next slide, please. We are a small nonprofit agency in the Triangle region of North Carolina. We have about 145 employees. We have grown considerably. We started with like 4 over the 50 years. We were 2 organizations in 2 separate counties that actually came together and merged in 1974. And we were our state's first child care resource and referral office in North Carolina. Some of you may be more familiar with who we are because we do teach educational scholarships. We provide child care wages and awards, salary supplement programs. And now we have grown from a local organization that influences at the state level, but now we are a national organization that actually is working with over 35 states in the US. Next slide. So our mission is that we want to strengthen accessible and affordable quality early care and education. And we do that by helping families through our resource and referral. We make ways for families to find childcare. We help them to pay for childcare, and we help them to understand what quality childcare means. And we make it easy for families. We support children. Not only do we do the R&R work, but we also have a meal service program. And so we prepare nutritious daily meals to children enrolled in surrounding childcare facilities. And we help teachers by allowing them to focus on educating the children and not having to worry about all those supplemental services. But in addition to that, we also have a footprint of developing our workforce. And that is really where I'm going to talk more about today. Next slide, please. So just as a reminder, and you've heard all of this already, so I'm not going to spend a lot of time here, but in order for CCSA, Child Care Services Association, to move these policy levers and to improve the qualifications and educational supports for the early childhood workforce, we had to do these things. We had to focus on the roles that we could do and our authority and what authority we had and how we could influence policy in our own roles and authority. We had to understand root causes. We had data, and that's a whole nother section of our organization is research and data collection. We also knew that we had to work with people, with programs, with structures and networks that you've heard so much about, and we had to take action. We weren't just going to stand around. We were going to use our influence in the ways that we could. Next slide. A couple of things that we learned along the way, and I want you to keep this in mind. I've already mentioned that we've been doing this work for 50 years. It always takes more time than expected. There are good things that happen, and you have to chalk up those little successes along the way. But to really see systematic change, it's going to take more time. And you can never, ever underestimate your power when you build the right relationships. Let me just echo those 2 things. It's going to take you more time than you're expecting, and you can never underestimate the power you have. You may not be a superhero, but you do have power. So what I want to do is really just talk to you about what happened for us. We engaged folks at the very grassroots level that you saw on the previous slide. We made sure that families were at the table. We made sure that child care providers were at the table. Families were demanding child care in the early 1990s, late 80s. And our child care providers were demanding at that time, they were demanding higher pay. That's been a long time ago, guys. But we began by building these relationships. We wanted to keep the process that I previously discussed. We wanted to make sure that people understood that we had relationships and we had power to build those and really make them make our voice heard and make the voice of the providers and the families heard. Next slide, please. So we also wanted to make sure that we understood the root causes, and we also wanted to make sure that we had the data so that we knew what we were going to work toward. And so in the late 80s, early 1990, we published our first workforce study of the early childhood workforce. And there were 3 things that came up or rose to the top as 3 challenges. These are not unfamiliar to you today, I'm sure, but we knew and we found out we had an undereducated workforce. We knew that there was poor compensation and there was high turnover. So we used this data with the demands from families and the early educators and the rising awareness of the community. And we brought partners together to find solutions. Next slide. In this slide, what you'll see is that we created one of the first education for North Carolina. We created Teacher Education Compensation Helps, which is a Teach Early Childhood Scholarship. We did it very small. Remember our influence. We were in Durham and Orange County. So we piloted this first in Orange County, and then we grew to our service area, which was 3 counties, Durham, Orange, and Wake. Luckily, that was a large populous area. We had a lot of childcare providers, but we wanted to address this undereducated workforce. So we found a way by working with our institutions of higher ed to send people back to school with debt-free education. We also heard as we were looking at the data that people felt unappreciated. And we also knew that by looking at our data that the large percentage, over half of our workforce, was Black and brown women. And so during this time, we knew all of this. There was also this emerging evidence about brain research and why early childhood was so important. So it set the stage that this made sense to move in this direction for us. Next slide. In 1990, CCSA created this professional development strategy, and we did it to address those top 3 data points that we found in our workforce study. Teacher education and compensation, our Teach Scholarship, we knew that it could make a difference. And we wanted you to understand what it truly is, because I don't think people realize what levels there are to this. It addressed all 3 of those data priorities. It is an initiative that was designed to provide sequenced educational scholarship opportunities to teachers, to administrators, but also to our family child care home environments. But they had to be they had to work in regulated or licensed settings. Move to the next slide, please. There are 5 components of every Teach Scholarship. The scholarship, which pays for tuition, but it also pays for books. It helps with travel costs. There's paid release time, and there's agreements that the local childcare providers where these teachers or administrators work have to commit and agree to make a difference in the pay, but also providing release time for these folks. So it addresses working conditions for these teachers as well. There is education. In order to keep a Teach Scholarship, you have a contract, and you have to complete a specified number of credit hours for that contract. It also addressed compensation, because it required bonuses to be paid at the end of a completed contract by the center administrators. But there's also bonuses built into the system in the Teach Scholarships themselves. And then there's a commitment. So it addressed turnover. There's a commitment that for every time you complete a contract, you have to then stay at your center to be eligible again. And there is a specialist who is dedicated to provide support and act as a navigator through the higher ed system for all of those participants. Next slide. In addition to that, another learning that we had early on in North Carolina is there's such an investment that needs to be made that we knew we couldn't do it with one strategy. There had to be multi-pronged and comprehensive strategies. So very soon, in 3 years later, after the initiation of the Teach Scholarship, we added a companion program called Child Care Wages. We really wanted to dig into that poor compensation and the high turnover. We also had data through our evaluation of the Teach Scholarship program that showed that low wages and there were no benefits and there was still lack of respect for people in the field. We also had a turnover rate which is lower than other states. But in North Carolina, the turnover rate was in addition of 31% in the early childhood field. And this was in the mid 1990s. So we wanted to address this. So we also complemented Teach with this salary supplement program. Next slide. This you see, not all superheroes wear capes. We may not be the superheroes ourselves, but I do believe that our teachers, when they get degrees, they become superheroes with what they can do with those young children and families. But this was a compensation initiative that paired so nicely with the professional development strategy of the Teach Scholarship. It enhances compensation by providing child care supplements. And then later in our history, what we did is we went and added an infant toddler awards plus, which really addressed just the salaries of infant and toddler teachers who in North Carolina made 13% less than those who were in preschool classrooms. Next slide. So again, what is it? It's an evidence-based salary supplement program for early educators. It is paid out twice a year in 6 months installments. It means that you have more education. The more education you have, it's still paired with education, the more your supplement is. And it was a way for us to increase compensation, education, and retention. Next slide. So those were two strategies that we used, but it really had an impact statewide. And I want to show you how those two strategies led to other things that were happening across the state. Next slide. So as I said, we issued the first checks with wages, which was our salary supplement program in 1994. It grew. And then we had a statewide opportunity after 5 years of running the program locally. Again, that's where our authority and that's where we had the role that we could play. But we had an opportunity to fund this with Smart Start. Smart Start, of course, many of you have heard of that. It was a Governor Hunt's initiative, and I'll talk a little bit more about that in a minute. And our state administrator, the North Carolina Division of Child Development and Early Education. So what happened is the local partnerships, we have 75 that cover the 100 counties in North Carolina. They could choose to use some of their education dollars to fund the supplements in their local counties. And it was very much local. They could choose how much they wanted to fund, how much to put in it based on their population. Then the division stepped in with CCDF dollars, and they were able to cover the administrative costs so that all of the money in the local level went directly to the teachers. And so we were able to braid and blend this funding so that we were able to expand it and give opportunities statewide. We have 64 out of 75 of our partnerships. We're serving 64 of our counties out of 100. We're still not 100%, but like I said, it takes time, and we are determined that we're going to reach a state level solution very soon. Next slide. We also then began to look at data, and this is some of the most updated data. This was from our last study, our workforce study in 2019, right prior to the pandemic. We had cut down across the state with these strategies. Our turnover rate was 21%, but people that were participating in the program, the turnover rate is even lower. It's 14%. And right now, this current year, in the middle of a workforce crisis, our turnover rate in people that are participating in the wages and awards program is at 9%, when other states across the nation are looking at 50 and 60% turnover rates. We also found, as I mentioned earlier, that our 3 to 5 year old teachers earned about 13% more. We knew that in 2019 that for one adult and one child, it cost a living wage was $35.73. You have to understand, we're in a small southern state. Our minimum wage is still $7.25 an hour, and to think that a living wage is $35.73, that's a lot. That's a big challenge. But we wanted to find a way to rebuild and support and increase the wages, but also to increase the pipeline itself. Next slide. So this is you know, as I said before, I've already gone through most of these. We were able to do some joint funding. And then in 2018, the division stepped forward with additional quality funds from the CCDF funding source, and they funded fully the infant toddler program with the quality set aside dollars that came into the state for quality for infants and toddlers. Next slide. This is just the results that I was talking about. Last year, our turnover rate in the midst of coming out of a pandemic and the workforce crisis at hand was 14%. The other thing, though, and you see the salary supplement is about $1,200 every 6 months, so $2,400 a year. It is not a huge $50,000 salary, but what we do know is it makes a difference. What we have heard from our providers is that it helps to reduce financial stress and kept them in the field. And you see that prior to this program, our turnover rate exceeded 30% in North Carolina. Next slide, please. So as we began to do these two strategies that were specific to our agency, we began to influence state level decisions. So data from our workforce studies and surveys, and from the Teach Scholarship and wage pilots, and then after numerous years of expanding, by listening to childcare providers and what parents needed, the system began to recognize the importance of early learning. And so we engaged our higher ed community. And in the 1996, there was a statewide curriculum improvement project where our community college system created a common course library so that every college in the state taught the same early childhood courses for the core. And so anybody that went to any of our state-supported community colleges got the same courses, and they were directly aligned with what they were required to have by the feds, as well as what was important at the time. We worked with our community college system to create a credential, which was an entry-level certification to become a lead teacher in the program, and there was administration credentials created as well. Next slide. I've got to get through this quickly. We also engaged our Division of Child Development, our state administrator. They created a think tank. This group still works today. The North Carolina Institute for Child Development Professionals is professionals from different sectors of the early childhood workforce who come together and figure out how to build these relationships and figure out how to make these connections and make things work. I've already mentioned to you that we were able to influence our CCDF plan and find funding through quality initiatives by starting something local. We also were able to influence our Child Care Commission, which is the child care rulemaking body with our QRIS system. We created back in 1999 the first QRIS system in the nation. I know we still fight with another state. I won't call their name as being who was first, but we, as North Carolina, say we are. But part of that QRIS system is still, it was influenced by the work that we did at our agency, because education of staff was a key component. And it was based on how we could support teachers to go back to school through Teach, and how they could get salary supplements with those higher levels of education. Next slide. We also had an advocacy arm that was important. The North Carolina Early Childhood Coalition, which is our advocacy arm. It is an organization that's solely devoted to early childhood advocacy. It started under our realm of Child Care Services Association. We were the fiscal agent. It has now become its own 501c3, but its purpose is to share information and resources with parents, professionals, and policymakers, and to set our policy agenda for all early childhood stakeholders. And I have to say that it works really well, because last year, as you'll see in just a moment, we got things passed that we've never had to happen in a southern state that is very, very politically conservative. Next slide. We also engaged our elected officials. It almost became a perfect storm. What you want to do is elect people that are early childhood champions, and that's what we had. Smart Start was created by Governor Hunt. He was the longest serving governor. He served 2 different terms with a break in between. And then he was followed immediately by another Democratic governor, Mike Easley, who then created our More at 4, or our state pre-K program. all again aligned with the work that we had done early on. And we even convinced our legislature that they funded this Teach statewide, that educational scholarship. There was over almost $3 million put into the state budget to fund Teach. Now that has since been transferred and it's now quality dollars from the feds, but it did start with the state funding it. Next slide. We also then were able to influence even bigger than that. By creating this Common Course catalog, we had a BK Higher Education Consortium where we were able to influence not just two-year institutions, but our 17 four-year educational state partners. And there was also research that got carried on based on some of the work that we had done. And what we found is that our students that were on Teach and had gone back to school, they did better as they transferred to those four-year institutions. So in 2018, North Carolina was able to create a statewide articulation agreement for any person that completed their early childhood degree at the community college could move on. Next slide. 25 years later. So this is just the elements of change that we talked about, that we created a shared vision that was so important. All of those different early childhood stakeholders had a shared vision of where they wanted to go in the state. We worked on relationships and connections. We understood the power dynamics. We understood our role, but we also understood the power dynamics and how we could influence those. We had the data to influence, to back us up. We then implemented practices that were working and that there was proven results. We found funding investments through blending, and we were able to affect policy change at the state level. Next slide. And just to sort of end on this, we're still working on this. We have solutions for the future. We want to continue to increase wages and provide benefits. And we've really zeroed in on trying to expand our pipeline for early childhood. The next couple of slides, I'll just push up on the screen and then we'll move on. Next slide. We've got a goal that by 2025, we're going to have 8,000 new teachers in our pipeline, and they're going to meet higher education qualifications. And this is how we are continuing to do it. Multiple pronged strategies, comprehensive. We're doing a public awareness campaign. We're asking for more federal and state investment. We've talked about some of the programs that helped us to build the provider pipeline, which we're now working with 7 states to do apprenticeships in our small organization. And we're looking at how we're raising our reimbursement rates. We're even looking at an alternative methodology for subsidy in North Carolina. Next slide. We've expanded with our Department of Ed, the secondary early childhood career and technical pathways. We've developed pre-apprentice and apprenticeship programs, and Teach is engaged in all of that and supporting those pathways as we move forward. Next slide. We've developed new courses. We've given prior learning experience. We developed a whole certificate, which is 18 semester hours of credit. One of our courses is related to health, safety, and nutrition. It directly aligns with the federal requirements for health and safety. We've done fast track programs in our community colleges. We've aligned all of this with Teach scholarships. We've developed a statewide CDA program. We've aligned Teach scholarships. We're giving credit for up to 7 hours of those courses for a CDA. So it's all these partners working together to make this happen. Next slide. And the very last thing that I'll say is we've also engaged our our legislative community last year in a state that is not very progressive. And we get a lot of pushback from the political right. We were able to get these introduced by a bipartisan early childhood caucus group led by early childhood proponents. And some of these have real potential for solutions as we move forward. So I'll stop there because I know we're over.
Dr. Snuggs, thank you so much. So much information. And I'm glad that we have these slides for people to review. We encourage you to look at the slide decks that are available on the website for review of the content from all of our partners who have given such rich information as Dr. Snuggs has today. We're going to do webinar 5 in March, I believe. And I'm sorry, I don't have the exact date. We're going to focus on compensation and financial relief, and particularly using the processes and information we've talked about today as well. Thank you so much, and I'm going to hand this over to Sandra to close us out. Thank you for your attendance. Apologies for us all going over a little bit.
Well, thank you, Dr. Ray and Dr. Killen Stewart and Dr. Snuggs, as always, for an amazing presentation and wealth of information. As you all know, we have our post-webinar survey that we ask that you complete as you exit today, and you'll likely saw that Dr. Ray and Dr. Killen Stewart have been digging into that information and responding and really thinking about that as they're planning out these final webinars. So please share that. Our next webinar is on March 25th. We're excited to see you there. And we have our next consultative session on March 19th. And there you'll have an opportunity to learn more from Dr. Snuggs and CCSA. So fill out the webinar, and we look forward to seeing you then. Thank you so much, and have a wonderful afternoon, evening, rest of your week.
Okay. Christy?